You may first notice it in a small moment. You answer the phone, and someone says, "I can't hear you." You try to speak across a room, but your voice does not carry the way it used to, or you talk for a few minutes, and suddenly your voice feels tired, thin, raspy, or strained. After 60, a changing voice can feel personal. It is not just a sound. It is how you speak to your family, ask questions at the doctor's office, join a conversation, tell a story, or make yourself understood. So when your voice starts to change, the question is understandable. Is this just aging? Or is your body trying to tell you something? The answer is not always one thing. Sometimes voice changes are part of aging. Sometimes they come from dryness, reflux, allergies, irritation, overuse, or a recent illness. And sometimes, when the change lasts or keeps getting worse, it is worth asking a healthcare professional to take a closer look. Your voice does not diagnose disease by itself. A raspy voice does not automatically mean something serious. A quieter voice does not automatically mean a nerve problem. But your voice depends on several parts of the body working together: breathing, muscle strength, moisture, nerves, and the small folds of tissue inside your voice box. When one part of that system changes, the voice may change with it. One common reason after 60 is age-related change in the vocal folds. These are the small bands of tissue inside the larynx. When you speak, air moves up from the lungs, the vocal folds come together, and they vibrate to create sound. With age, those folds can become thinner or less full. In some people, they do not close as firmly as they once did. When that happens, extra air can leak through while speaking. That is one reason a voice may sound breathier, weaker, thinner, or more strained than before. Some people describe it as having to work harder just to be heard. They may avoid noisy restaurants, group conversations, or phone calls because speaking takes more effort. They may feel fine at the start of a conversation, but after a while, the voice begins to fade. This can be frustrating, and it can also be confusing because many people are told, "That's just getting older." Sometimes it is, but aging should not become a reason to ignore every change. One common misunderstanding is that hoarseness after 60 is always normal. It is not. Another misunderstanding is that hoarseness always means something dangerous. That is not true either. The better question is, what is the pattern? Did your voice change after a cold or allergy flare? Has it lasted longer than expected? Does it improve with rest? Or is it getting worse? Is there pain, trouble swallowing, trouble breathing, coughing up blood, unexplained weight loss, or a lump in the neck? Those details matter much more than the sound alone. A temporary raspy voice after a cold is common. The vocal folds can become irritated and swollen, and the voice may sound rough or weak while the body recovers. Reflux is another possible reason. Many people think reflux only means heartburn, but irritation that reaches the throat area can sometimes be related to hoarseness, throat clearing, cough, or a feeling that something is stuck in the throat. This does not mean every hoarse voice is reflux, but if the change happens along with frequent throat clearing, nighttime cough, sour taste, or symptoms after meals, it is worth asking your doctor about. Dryness can also affect the voice. The vocal folds need moisture to vibrate smoothly. If the throat is dry, if the air in the home is dry, or if a person is not getting enough fluids, the voice may feel rougher and less reliable. Medications can also play a role for some people. Certain medications may contribute indirectly to dry mouth, throat dryness, cough, reflux symptoms, or dehydration effects. That does not mean you should stop taking anything on your own. But if your voice changed after starting a new medication or changing a dose, it is reasonable to review it with your doctor or pharmacist. Then there is voice strain. Speaking for long periods, shouting across rooms, talking over background noise, frequent throat clearing, or forcing the voice when it is already tired can irritate the vocal folds. Over time, that can keep the voice from recovering. And sometimes persistent voice changes may be linked to structural or neurological issues. These can include benign growths on the vocal cords, changes in vocal fold movement, stroke-related changes, Parkinson's disease, or, less commonly, cancer. This is why a voice change that does not go away should be evaluated rather than guessed at. That point is important. The goal is not to frighten you. It is to keep the message balanced. Most voice changes have common explanations. But a voice that stays hoarse, weak, breathy, or strained for weeks deserves attention. So what should you watch for? Notice if your voice is consistently quieter than before. Notice if it becomes raspy, breathy, shaky, strained, or unusually tired after speaking. Notice if people keep asking you to repeat yourself. Notice if you start avoiding conversations because speaking feels like work. Also pay attention to symptoms that should be checked sooner: trouble breathing, trouble swallowing, coughing up blood, ongoing pain, unexplained weight loss, a lump in the neck, or a voice change that keeps worsening. A practical rule is this: if hoarseness or voice trouble lasts more than a few weeks, especially when it is not clearly connected to a cold or respiratory infection, it is worth talking with a qualified healthcare professional. Depending on the situation, that may start with a primary care clinician. Some people may need an ear, nose, and throat specialist. Others may benefit from guidance from a speech-language pathologist. The right step depends on the person and the pattern. There are also safe habits that can support your voice. Start with hydration. The voice often works better when the throat and vocal fold surfaces are not dry. Drinking enough fluids throughout the day can help support voice comfort, although it is not a cure for an underlying medical problem. Use your voice with care. If your voice is tired or hoarse, try not to force it. Instead of shouting across the house, move closer. Instead of competing with loud background noise, reduce the noise when possible. These small changes can reduce strain. Be careful with repeated throat clearing. It may feel helpful in the moment, but doing it again and again can irritate the vocal folds. If you constantly feel the need to clear your throat, ask a clinician about possible causes such as reflux, allergies, dryness, or mucus, and do not assume whispering is always the safest way to rest your voice. For some people, whispering can create more strain. Gentle voice rest, and speaking softly without forcing, is often a better approach than constant whispering. Avoid smoke and secondhand smoke when possible, because smoke irritates the throat and vocal cords. If someone has ongoing hoarseness and a history of smoking, that is another reason to get checked rather than waiting indefinitely. Be cautious with home remedies and supplements marketed for voice repair. A warm drink may feel soothing. A lozenge may make the throat feel more comfortable for a while. But these do not explain why the voice changed, and they should not delay medical evaluation if the change is persistent, worsening, or unusual for you. The main lesson is simple. Your voice can change with age, but aging is not the only possible reason. A weaker voice may be related to thinner vocal folds, reduced breath support, dryness, reflux, allergies, irritation, medication effects, or other health issues that need professional evaluation. Your voice is not just sound. It is connection. It is confidence. It is how you stay present in conversations and how you advocate for yourself. So listen to the pattern. A short-term raspy voice after a cold may improve with time, but a voice that keeps changing, keeps weakening, or comes with other symptoms is worth discussing with a qualified healthcare professional. Do not jump to the worst conclusion, but do not dismiss a signal that stays. After 60, your body may speak in subtle ways before it speaks loudly. Sometimes one of those signals may be the sound of your own voice. This video is for education and does not replace medical advice. If you have sudden, severe, persistent, or worsening symptoms, talk with a qualified healthcare professional. And if you want more calm, clear explanations of the body signals that can appear after 60, subscribe to the channel and keep learning how to listen to your body with less fear and more understanding.